My name is Dr. Shermi Parikh. I'm a board-certified podiatrist in Berwyn and in Niles, and I'd like to talk a little bit about minimally invasive foot care treatment. I use minimally invasive foot care treatment for the treatment of bunions, hammer toes, heel pain, laser toenail for fungus, and for ingrown toenails. So I'd like to talk a little bit in detail about each one of those things. So for bunions and hammer toes, I perform minimally invasive foot surgery. What that means is that I use a small incision to correct the bunion or the hammer toes and many other things as well, sometimes calluses on the bottom of the foot or other areas that are troublesome. But the main idea is using a small incision, not using a screw or a pin. This leads to a faster and less painful post-operative recovery, and you don't have a long, ugly scar on the top of your foot after the surgery is done. Now, for heel pain, a lot of times we are able to treat heel pain without surgery. And some of the things that I use in my office that are a little bit different are laser treatment. I have found my laser to be very effective with treating plantar fasciitis or heel pain. The laser penetrates the cells and it causes a decrease in inflammation and it causes an increase in circulation to the area. So you're really using your body's own natural way to treat inflammation and harnessing it to treat plantar fasciitis. I've had great success with using it for plantar fasciitis. Another way that's minimally invasive are different types of injections. So I know a lot of people are familiar with cortisone injections. I do use those. I also use amniotic cell injections, which is taking the amniotic fluid after a mother has given birth or during an amniocentesis. The amniotic fluid is processed and cleaned of any DNA, and then it is injected into areas of inflammation. And again, we are using our body's own natural abilities to heal itself. It's kind of supercharging your body's immune system, and that way it's not introducing something foreign, it's using your body's own natural anti-inflammatory defenses. For ingrown toenails, it's amazing how a little piece of ingrown nail can cause so much pain. And so I use a small, a little incision to remove the part of the nail that is ingrown, and then, of course, under local anesthetic, and then using a chemical to kill the root of the nail so the nail doesn't grow back. And again, that is something we can do in the office. It's a pretty simple procedure, about 30 minutes, and that can alleviate someone's pain immensely who's suffering from ingrown toenails. And lastly, for the laser treatment for fungal toenails. Fungal toenails can be very embarrassing, and they're ugly, and people don't like to wear sandals and things like that. And I offer laser treatment for the treatment of the nails, and sometimes with a combination of medications, either topical or the medication that you can take internally. And so these are some of the treatment options that I offer in my office. My offices are in Niles and in Berwyn, and my website is www.familyfootanklecenterniles.com. Thank you.